7 2024 prelims. Okay, so here hope you all have given your best in your exam. So here where we will discuss some of the recall question of the NORCET. Okay, so this is my Telegram channel. Here also you can get. Okay, so full form of in NORCET prelims, some of the full form they have asked like GPS, Global Positioning System, HTML, Hypertext Markup Language, DRDO, Defense Research and Development Laboratory, HART, Highly Active Antiretroviral Therapy. So this four were the full form in the NORCET prelims 2024. Next question, we will see the weak zone of the earth crust layer, that is seismic layer will be the answer. Cosmic, seismic, formic and anemic. So seismic is the weakest zone. So during the earthquake also you will see the seismic zone mostly affected. Next question, like total gold medal won by the India in Paris 2024 Paralympic. So the options were 2, 7, 8 and 9. So 7 medals, 7 gold medal were won by the India, like and 9 silver and 13 bronze. Total 29 medals were won by the India. Next we have classical sign of the autonomic dysreflexia. So classical sign, that is hypertension and bradycardia is the classical sign. Typically we will see the sudden increase in the blood pressure and the reflective slowing down of the heart in the autonomic dysreflexia. So options were hypertension, bradycardia, hypotension, tachycardia, hypertension, tachycardia, hypotension, bradycardia. So hypertension and bradycardia is the right answer. The next question, that is the correct placement of the ECG. V1 first V1 electrodes where at the fourth intercostal space at the right. So on the right side of the chest we are placing in the fourth intercostal space first electrode, V1 electrode. Next they have asked the questions like yellow papaya due to presence of so they have asked the color of yellow, means presence of yellow color in the papaya due to presence of which enzymes or which components. Okay, compound. So Carica xanthine is the main components for the responsible for the yellowish papaya. Lycopene, papain and prunicine, it is also present in the papaya, but other agents are responsible for the redness of the papaya, or some of the agents are present in the seeds of the papaya. Okay, next we will see the next question, which month is considered as the Poshan Ma. So September is the mostly considered as the Poshan Ma. So from the 1st September till the 30th September it is considered as the Poshan Ma. Next question, in which condition of the vaginal discharge presence of irritation, green frothy discharge and dyspareunia has been seen? So here we can see the chlamydia, gonorrhea, trichomoniasis. We can see the green frothy discharge, vaginal discharge can be seen in all three conditions like trichomoniasis, chlamydia and gonorrhea. But the most appropriate answer among all these questions, as they have shown the irritations also and the itching also, so trichomoniasis is the best selective answer here. In Candida mainly you will see the white discharge or cuddy discharge. Okay, next we have Bande Mataram scheme for which population? So mainly for the Bande Mataram scheme is started only for the pregnant women. So they will provide the free OPD service including antenatal checkup, and it made available for all the pregnant women. Okay, next question we have one image based question. So Keeland forceps they have given. So from the recall here you can see the, and this is Simpson, Elliott, Piper and Keeland. So Keeland forceps they have given in the questions. Okay, next we have immunization schedule. From the immunization they have asked at the 6th week of the what all immunization can be given. So they have given so many in options. So right answer were Penta 1, Penta first dose, Rota first dose, PCV and OPV. So this is the national so you can revise the national immunization schedule from here. Okay, at the birth we are giving BCG, OPV 0 dose and hepatitis B 0 dose. So at the 6th week first dose of all three things like OPV, Penta and Rota, and at 10th week OPV second dose and pentavalent second dose and rotavirus second dose. Okay, so like that it is. Next you can see one image based question they have given. So this were mottling of the skin, mottling they have given. Okay, next they have asked a 7-month-old child recommended dose of the vitamin A. So mainly you can see like from the 6th month till the 9th month till 11th month the recommended dose for the vitamin A, for dose of the vitamin A, that is 1 lakh international, and from 12 month till 59 month till 5 year we are giving 2 lakh international unit to the child. Okay, next they have given one image. So that was the triple human urinary catheter. Next we have central venous catheter. They have asked the different port, from which port mainly they have which port is used for the what purpose. So mainly here you have to remember that medial port is mainly used for the TPN purpose, mainly total parenteral nutrition, and mainly the proximal port as white port is mainly used for the CVP measurement, and others like from distal port we can we can take the sample also, and we can administer the medication also. Sometimes medial port also can be used for the blood sampling. Okay, next they have given one image based question. So it is a sterilization technique for the fallopian tube. So this is the modified Pomeroy technique. Okay, next they have asked the one non-hormonal, non-steroidal contraceptive pills, which is also known as the Chaya and the Saheli. Okay, so Saheli is also we are knowing like it is a non-steroidal or a contraceptive for the female. Okay, next we have a patient consuming MAO inhibitor, monoamine oxidase inhibitor. Mainly if they are consuming this and that patient has consumed the cheese and developed a reaction, as the patient should avoid diet restriction. Mainly in case of the a patient who is consuming the MAO inhibitor medications or this type of supplements, so they have to avoid all the all the diet or food which contains the cheese or contain the tyramine. So tyramine rich diet should be avoided in this case. So here you can discuss the cheese reaction can be taken place if a person is taking food containing in the tyramine. So we should avoid the tyramine containing food. So it will react, both drug and cheese will react and leads to the cheese reaction, leads to the hypertension and headache. And here you can see all the reactions of the tyramine reactions with the MAO inhibitor, the cheese reaction, all the functions, how it affects and how it will lead to the hypertension and the further side effects. Next, they have given one questions like Mr. Manish is the patient of Dr. Suresh in psychiatric OPD. So they have given one patient and they are visiting to the psychiatric OPD. Mr. Manish is considering Dr. Suresh as his father. When the doctor disapproves, if any suggestions like Manish wants to take from the Dr. Suresh, he is disapproving or denying from that suggestion. So it creates guilty or anxiety in the patient. So it is a transference. It is a type of a transference defense mechanism. So here they have asked, projection is mainly like blaming others for the for own mistake. We are blaming others. Okay. In the counter transference, when some health personnel like any doctor or any nurse has developed any connection or any interaction or any emotional attachment towards the patient, that is called counter transference. Okay. Next they have questions they have asked here: water hammer pulse seen in aortic regurgitation. Okay. So these all are the recall based question only. So sometimes we can't get all the options here. Okay. So next question they have asked: what size needle for the vitamin K injection in the newborn we are using? Okay. So we want to administer the vitamin K injection to the newborn. So what size of needle mainly we are using? So 26 gauge mainly we are using in case of the to give the vitamin K injection IM. Okay. Mainly we are using the vastus lateralis muscles, most common site to give the vitamin K injection IM. Okay. Next question, they have given one injection images like injection carboprost used for the treatment in which condition? So mainly we are using in the PPH condition. Mainly we are using it is a prostaglandins analog, mainly to control the postpartum hemorrhage. Mainly we are giving here. Okay. Next we have Huntington teeth and saddle nose. So here you can see the congenital syphilis. This is the Huntington triad mainly it is used. So here you can see the Huntington teeth, mainly molar like teeth, mulberry molar, and sensory neural deafness you will see, and interstitial keratitis, and also you can see other symptoms like saddle nose, sculpture like nose. Okay. So in the congenital syphilis mainly we will see. In Edwards syndrome mainly we will see the rocker bottom feet or overlapping of the disease, some renal problems, some kidney issues, intellectual disability, that we can see there. Okay. So in Down syndrome no symptoms like that, like sandal gap, single palm creases, that we can see. In tetralogy of Fallot, mainly the 4 cardiac defect we are seeing like VSD, RVH, pulmonary stenosis, overriding of aorta. So these 3 symptoms from the elimination technique also you can answer this. Like this is mainly seen in the congenital syphilis. Okay. Next, they have given one graph like this. So they told to identify the graph. So this is not a bar graph, histograph, pie graph, pie chart, and scatter plot. See, this is the scatter plot, a type of scatter plot. Okay, so answer is the scatter plot. Next is they have asked which hormone is responsible for the regulation of the blood calcium level. So mainly, if you will see the mainly 2 hormone is responsible for the blood calcium level regulation, also to maintain the blood calcium level in the blood. So mainly 2 hormone like parathyroid and calcitonin. But if you will see the dominant one, that is parathyroid hormone. Mainly you can see like parathyroid hormone increase the blood calcium level when it is too low in the body. Okay. But calcitonin will decrease the blood calcium level when it is too high in the body. Okay. So here among these 2 options, parathyroid hormone is act as a dominant role to maintain the blood calcium level inside the body. Okay. So thank you so much for your cooperation. So later we will upload the part 2 for the today's questions if we will get some of the response. So thank you so much. So this is a Telegram group also, you can join.